Welcome to the deep dive. Today, we're going to be diving into the world of health education.
Okay.
And we're looking at some research by Dr. Tim Lynch.
Sounds interesting.
And he's making a pretty compelling argument about how we train health and PE teachers.
Yeah. How so?
You ready to
Ready?
hit school?
Let's do it.
Okay.
I think what's really interesting about this is that Dr. Lynch is really pushing for a pretty big shift in how we think about these things. He's saying that where we train these teachers, it kind of sends a message
Yeah.
about how we view health itself.
Let's break that down a little bit.
Okay, sure.
So what Dr. Lynch is saying is that keeping health and PE teacher training separate from
Right.
the main education department at a university can inadvertently make health feel like this exclusive club. Right.
Yeah. And if we look at what's happening in the wider world, too,
Mm-hmm.
it makes you wonder if he's really onto something.
Yeah.
You know? We've got these super specialized fitness routines, boutique gyms popping up everywhere.
Mm-hmm.
Even health foods are being marketed as luxury items.
Right.
It's almost like health is becoming something you have to buy into.
Literally.
Literally, yeah.
So is he saying it's bad to have like
I don't think so.
fancy gyms or to really focus on your niche fitness goals?
Not necessarily, no. I think
Right.
it's more about
Okay.
recognizing that this trend could be making health feel out of reach for some people.
Right.
You know, if you can't afford the expensive gym or the organic produce,
Mm-hmm.
does that mean you're somehow less healthy?
Right.
I think Dr. Lynch is concerned about that message.
That's an interesting point.
Yeah.
But I think some people might say, hold on, don't teachers still learn the same information regardless of where they're trained?
That's a good question.
What would you say to that?
I think that brings up the idea of pedagogy,
Okay,
which is just a fancy word for how to teach,
got it.
you know.
Mm-hmm.
And Dr. Lynch points out that for other subjects,
Mm-hmm.
even really complex ones, we
Yeah.
train teachers in education departments, right? Like,
Right.
it's not enough to just know the facts.
Right.
You need to know how to make those facts stick with students.
So, like, I could know everything about biology,
Yeah,
but if I can't explain it in a way that gets teenagers engaged,
exactly.
what's the point?
Exactly.
Right.
And especially when we're talking about health,
Mm-hmm.
which can be a really personal and sometimes sensitive topic,
Yeah.
that connection between the teacher and student is even more important.
Thinking back on it,
Yeah.
I remember a few teachers who made health class actually interesting, you know?
That's what good pedagogy is all about.
Yeah.
It's about making that subject matter relevant and engaging for those students.
So if separating health and PE training sends kind of the wrong message,
Right.
what message do we want to send?
Well, I think that's where the importance of teacher training comes in.
Hmm.
You know, if we want to make health feel accessible and relevant to everyone, we need teachers who are trained not just in health content, but in the art of teaching itself.
So Dr. Lynch is saying that good health teaching goes beyond just knowing the facts about nutrition or exercise.
Precisely.
Okay.
It's about creating a learning environment
Mm-hmm.
where students feel comfortable
Right.
asking questions,
Oh.
exploring different perspectives,
Hmm.
and figuring out what works for them.
So where does PE fit into all of this? I'm guessing Dr. Lynch has some thoughts about how PE is often separated from
He does?
other subjects too?
He does, yeah. He actually uses this phrase, separation of the physators,
Okay.
which I think is a really evocative way of putting it. You know, it
Mhm.
creates this sense of them versus us.
I'm curious to
Right.
hear more about that.
Yeah.
Does he think there's something inherently wrong with having like
Great question.
a strong PE program or even like sports teams
Mm.
and fitness clubs?
It's not about demonizing those things.
Well-
You know, sports and fitness can be amazing for building community and promoting physical activity.
Right.
But what Dr. Lynch is highlighting
Mm-hmm.
is the potential downside of that separation.
Okay, I see where this is going.
Yeah.
So he's worried that
Hmm.
by separating PE and health,
Yeah.
we might accidentally reinforce the idea that fitness is only for a certain type of person,
Right.
the sporty type.
And if that's the message we're sending,
Yeah.
it could be alienating a whole group of students who might not identify as athletic,
Mm-hmm.
but who still need and deserve quality health education.
So it's not about
Yeah.
getting rid of sports teams.
Right.
It's about making sure that
Exactly.
health education feels inclusive
Absolutely.
to everyone.
And remember, this isn't just about feeling good.
Right.
It's about actual health outcomes.
Right.
Dr. Lynch actually cites a report card that looked at the well-being of young Australians.
Oh, wow.
This report card,
Okay.
put out in 2013
Mm-hmm.
by the Australian Research Alliance for Children and Youth, assessed a bunch of health factors, and, well, the results weren't great.
Like bad report card, gotta hide it from your parents bad.
Kind of, yeah. Things like rates of diabetes and asthma in young people.
Wow.
Even things like how many kids are staying in school.
Mm-hmm.
Australia didn't do so well compared to other developed countries.
That is pretty concerning.
Yeah.
It makes you wonder, is there a link between those not so great health outcomes
It's definitely a question worth asking.
and how we're teaching kids about health?
If young people are struggling with these issues,
Mm-hmm.
could it be that the way we're approaching health education isn't as effective as it could be?
So we've talked about
Yeah.
the potential downsides of separating PE and health.
Right.
But I'm curious, what does Dr. Lynch suggest we do about it?
Well, he's advocating for a pretty significant change.
Okay.
He thinks health and PE teacher training should be moved into the main education departments
At universities.
at universities, yes.
So instead of being trained in like
Mhm.
specialized faculties like health science or sports science,
Right.
they'd be trained alongside
Yeah,
teachers of other subjects.
exactly.
Interesting.
And his reasoning is that this would send a powerful message
Mm-hmm.
that health is an integral part of a well-rounded education,
Right.
not something separate or
Mhm.
specialized.
So it sounds like he's trying to break down those walls
Yeah.
between like visitors
Yeah.
and other teachers.
He actually did some research, too,
Oh, wow.
to see if this idea had any support.
Okay.
He surveyed a bunch of primary school principals
Mm-hmm.
and asked them what they valued most in an HPE teacher.
I'm dying to know
Uh,
what they said.
Yeah, what do you think they said?
Did they say they wanted someone who was like a top athlete
Okay,
or had a really deep understanding of like
interesting.
complex medical
Their top priority was good teaching skills.
Oh, wow.
Yeah.
Interesting.
They wanted someone who could manage a classroom effectively,
Right.
create engaging lessons,
Mm.
and differentiate instruction to meet the needs of all students.
So it sounds like principals are less concerned with
Yeah.
teachers being like fitness gurus
Right.
and more concerned with them being,
Exactly.
well, good teachers.
Exactly.
Right.
They recognized that teaching health effectively
Mm-hmm.
requires a specific set of skills,
Yeah.
just like teaching math or history does.
That makes a lot of sense.
Yeah.
It's kind of like you could be the world's leading expert on nutrition,
Right.
but if you can't explain it to a classroom full of 10-year-olds
Right.
in a way that they understand and find interesting,
Exactly.
that's the point.
It's all about making that connection with the students
Right.
and finding ways to make the learning relevant to their lives.
And that's something that's emphasized
Yeah.
education department.
In education departments, right?
This all seems especially crucial. When you think about
Mm-hmm.
primary school,
Absolutely.
those early years are
Mm.
so important for establishing those healthy habits.
Absolutely.
Right.
And Dr. Lynch argues that by training HPE teachers in education departments,
Mm-hmm.
we can equip them with the skills they need to create those positive early experiences
Right.
with health and well-being.
So we've covered a lot of ground here.
You have.
We've talked about the potential downsides
Yeah.
of separating PE and health,
Mhm.
the importance of good teaching skills,
Right.
the need for a more inclusive
Yeah.
approach to health education.
It's a big topic.
What does this all mean for our listener?
That's the question, isn't it?
You know,
Yeah.
the person tuning in to the deep dive.
I think it comes down to this.
Okay.
If we truly believe that health is for everyone,
Mm-hmm.
we need to start reflecting that belief in our systems and institutions.
So is this just about changing
Well, it's definitely a key piece
teacher training programs?
of the puzzle,
Or is there more to it?
but it's also about fostering a culture of health that's truly inclusive.
Okay.
It's about challenging
Okay.
those narrow definitions of fitness and wellness
Mm-hmm.
that can make people feel excluded.
So not just accepting the health as a luxury idea
Exactly.
that we see so often these days.
We need to push back against that
Mm.
and advocate for policies that promote health equity.
So that could mean
Yeah,
supporting initiatives that
exactly.
make healthy food more accessible in low-income communities.
Yeah, things like that.
Creating safe spaces
Mm-hmm.
for physical activity.
Absolutely.
Or even just reducing the stigma around mental health
Mm-hmm.
so that people feel comfortable.
Exactly. It's about creating an environment that supports well-being for everyone.
It sounds like it's not just about
Right. It's a
big policy changes, but also about
Yeah,
the little things we do
absolutely.
in our own lives.
It could be as simple as supporting local farmers markets, volunteering with organizations that promote health in underserved communities,
Right.
or even just checking in on friends and family to see how they're doing.
Right.
All those little actions add up.
All those little actions add up.
It's about creating a ripple effect.
It's about creating a ripple effect, yeah.
And I think it's important to remember that this isn't about achieving some perfect ideal of health.
Right.
You know, we're all on our own journeys.
That's a good reminder.
Yeah.
It's not about beating ourselves up for not being healthy enough.
Right.
It's about making progress, being
Mhm.
kind to ourselves,
Exactly.
and supporting each other along the way.
Couldn't have said it better myself.
Well, I think that about wraps up our deep dive into the fascinating world of health education.
It has been a fascinating conversation.
Big thanks to Dr. Lynch for his research and for inspiring us to
Yes. Thank you, Dr. Lynch.
think differently about how we approach health.
Absolutely.
And to all our listeners out there, thanks for joining us on the deep dive.
Thanks for listening, everyone.
We'll catch you next time.
I think Dr. Lynch's research really challenges us
Okay.
to think beyond those individualistic ideas of health.
Yeah.
You know,
Yeah.
it's not just about telling people to eat their vegetables and go for a run.
Right. It's about.
It's about recognizing that
Yeah.
our environment
Mm.
plays a huge role
Yeah.
in shaping our health choices.
Right.
You know, if healthy options aren't available or affordable,
Right.
it makes it that much harder
Yeah.
for people to prioritize their well-being.
It's almost like setting people up to fail, right?
Yes.
Like telling them to go exercise, but
Yes.
then not having any parks or safe places
Right.
to be active in their neighborhood.
Exactly. We need to think about those systemic factors
Right.
that influence health,
Mm-hmm.
socioeconomic disparities,
Mm-hmm.
access to healthcare,
Mm-hmm.
even things like
Yeah.
cultural norms
Right.
that might discourage certain groups from seeking help
Right.
or engaging in certain activities.
So where do we go from here?
That's the big question.
If we want to create this
Yeah.
more inclusive, supportive
Right.
health culture,
Mm-hmm.
what are some practical steps we can take?
Well, I think it starts with awareness, you know, having conversations like this,
Right.
challenging those narrow definitions
Mhm.
of health and fitness that we've been talking about.
So not just accepting the health as a luxury idea
Exactly.
that we see so often these days.
We need to push back against that
Right.
and advocate for policies that promote health equity.
Okay, so that could mean
Yeah.
supporting initiatives that make healthy food
Right.
far
Exactly.
more accessible.
In low-income communities,
Mm-hmm.
creating safe spaces
Absolutely.
for physical activity,
Well,
or even just reducing the stigma
right.
around mental health.
It's about creating an environment
Yeah.
that supports well-being for everyone.
It sounds like it's not just about
Right. It's about
big policy changes,
Yeah.
but also about
yeah.
the little things we
Yeah.
do in our own lives.
It can be as simple as
Yeah.
supporting local farmers markets, volunteering with organizations
Right.
that promote health in underserved communities,
Right.
or even just checking in on friends and family to see how they're doing.
Right. Yeah.
All those little actions add up.
All those little actions add up.
It's about creating a ripple effect.
It's about creating a ripple effect. Yeah.
And I think it's important to remember that this isn't about
Right.
achieving some perfect ideal of health.
Mm-hmm.
You know, we're all on our own journeys.
That's a good reminder.
Yeah.
It's not about beating ourselves up for
No,
not
it's not.
being healthy enough.
Exactly.
It's about making progress, being kind to ourselves,
Absolutely.
and supporting each other along the way.
I couldn't have said it better myself.
Well, I think that about wraps up our deep dive into
It has been a fascinating
the
conversation.
fascinating world of health education.
Big thanks to Dr. Lynch for his research and for inspiring us to
Yes, thank you, Dr. Lynn.
think differently about how we approach health.
Absolutely.
And to all our listeners out there,
Thanks for listening, everyone.
thanks for joining us on the deep dive.
Yeah.
We'll catch you next time.
Yeah, and it's not like we haven't seen this before,
Right.
you know? Like, think about how we
Thank
approach
you.
smoking.
Right.
It used to be
Yeah.
totally normal
Everywhere. Yeah.
to smoke everywhere.
Yeah.
And then we started understanding the health risks.
Right. And we changed
And we
things.
changed our policies, our norms, our attitudes.
And now it's like crazy to think
It's crazy to think
that people used
you-
to
smoking
jump on airplanes.
Right.
Right.
Like, it's just wild
So we've seen
that we know
you can
change is possible.
change things.
We just need the collective will to do it.
I love that. We just
Yeah.
need the collective will to do it.
Because health
Oh,
is a collective issue.
yeah.
It's not just
It's not just
about
about
individual choices.
personal responsibility.
It's about creating a society
Yeah.
that supports well-being for everyone.
Well, I think that's a great place to leave it.
I think so, too.
We've covered a lot of ground today.
You have.
But I think
Yeah.
the main takeaway
Mm-hmm.
is that health really is,
For everyone.
health is for everyone.
And that we all have a role to play
Absolutely.
in creating a healthier, more equitable world.
Couldn't agree more.
So big thanks to Dr. Lynch for his research
Yes, thank you, Dr. Lynch.
and for sparking this important conversation.
It's been a pleasure.
And to all of our listeners out there, thanks for joining us on the deep dive.
Thanks for listening, everybody.
We'll catch you next time.